The views expressed by Dr. Joel Wallach and others on the following live paid program represent opinions of the participants only and do not necessarily represent those of the ZBS Radio Network's staff, management, advertisers, or affiliates. If something is said which you find offensive or with which you disagree, the ZBS Radio Network urges you to call the program in order to help us balance comment. This program is meant to present nutritional information only and is in no way meant to replace the advice of your medical doctor.
And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
And sitting in for Dr. Joel Wallach today, we do have Dr. Peter Glidden. Welcome back to the show, Dr. Glidden.
Hey, Doug. It's always a pleasure to be here. Hello, Radio America. How's everybody doing today? Listen, or tonight, some of you people I know are listening around this country are steadfast followers. Tune in midnight or after that, and we appreciate your support because we need your help, ladies and gentlemen. And this is what I'd like to talk to you about in the first segment here. I'm Dr. Peter Glidden. I'm a licensed naturopathic physician. I have 23 years of clinical experience providing patients with safe, effective, science-based, clinically verified alternatives to drugs and surgery. Now, don't get me wrong. There's nothing inherently bad or evil with drugs or surgery, and as a matter of fact, correctly prescribed medications will save your life. But when you think about it, of the thousands of prescription medicines that there are, and there are thousands, the only category of prescriptions that fix anything are antibiotics, right? You can fix an infection, you can fix pneumonia, you can fix bronchitis. But for most of the conditions that most people go to the doctor for most of the time, things like high blood pressure and type 2 diabetes and arthritis and osteoporosis and insomnia and anxiety attacks, etc., prescription medication can only manage the problem. Can only manage the problem. We need to get it one thing straight. Medical doctors, bless their hearts, do not practice health care. They practice disease management. There's a gigantic difference between disease management and health care. Now, Dr. Wallach, in his infinite wisdom, set longevity up as a networked business. And he did this on purpose. And I want you to think about this. And by the way, Dr. Wallach removed himself from the revenue stream of the vitamin business on purpose. The longevity company could sell $100 million worth of vitamins this year, and Dr. Wallach would make zero revenue from that, zero revenue. Dr. Wallach did that on purpose in order to deflect criticism from his critics, which are many, that say, oh, that Dr. Wallach, he's just trying to make money selling vitamins. Well, it's nonsense because he makes no money selling vitamins. And here's why Dr. Wallach chose to set longevity up as a network business. When he was doing research for Yerkes Primate Research Center, he discovered the cause and the cure for cystic fibrosis. Cystic fibrosis, he determined, was not a humans-only disease. It could happen in monkeys. And he could make it happen at will in monkeys by simply removing the mineral selenium from the diet of the pregnant mother. So if the pregnant mother monkey was deficient in selenium, the gene that coded for cystic fibrosis was turned on and the little baby monkey was born with cystic fibrosis. If the mother had enough selenium in her diet, the baby did not get cystic fibrosis. It was that simple. And for this earth-shattering breakthrough in medical science, Dr. Wallach was fired by Yerkes Primate Research Center, and it was all over the news for about 6 weeks. Dr. Wallach was interviewed on 2020 with Hugh Downs. It was front-page news in major newspapers all around the world, right? Cystic fibrosis cure, doctor fired. And why was he fired? Because there's no money in selenium. You can't patent a naturally occurring substance. So Dr. Wallach learned from an early age, an early time in his career, that medicine in the United States is completely guarded. The front door of medical knowledge and information in the United States is completely guarded by big pharma and by big money. And it is big money, ladies and gentlemen. There is no free market in the medical industry in the United States. Since 1915, 1920, more or less, medicine in the United States has been completely monopolized by MDs practicing pharmaceutical-centered allopathic reductionistic medicine. This is all that we have, our insurance gives us access to, right? Dr. Wallach understood this. Now, he could have chosen to sell Youngevity, to set Youngevity up as a normal vitamin company, and you could go to CVS and buy Youngevity vitamins at CVS or at your local health food store, but he didn't. He could have chosen to set Youngevity up as a physicians-only line of supplements, so we develop very high-quality nutritional supplements and only sell them to doctors. He did not do that. He chose on purpose to set Youngevity up as a networked business, on purpose, for one reason and one reason only, to change the way that medicine is practiced in the United States. Because we can't go through the front door. The front door is guarded by big pharma and by gigantic moneyed interests. So, we can't go through the front door. We're going through the back door. And how are we going to do it? We're going to do it by building a giant grassroots network, a coalition of informed citizens telling their friends and family members and community members and church members, listen, I know a Nobel Prize nominated physician with over 30 years of clinical experience, published 70 times, who says you don't have to suffer from type 2 diabetes. You don't have to suffer from arthritis. You do not have to suffer from high blood pressure. If I lend you this CD, will you listen to it? It's that simple, that straightforward, and that easy. We suffer from two myths in this country. Myth number one, that medical doctors own medicine and everybody else is a quack. It couldn't be further from the truth. The majority of people selling snake oil in this country have MD after their name. Myth number two, healing is difficult. It is not. Surgery is difficult. If you want to try to remove an infected kidney from somebody, you better have medical training. But teaching people how to recover their health with medical nutrition is easy. It's easier than falling off a truck. That's why Youngevity exists, and that's why we need your help. Ladies and gentlemen, Dr. Peter Glidden, standing in for Dr. Wallach. We'll be back with you on the other side of the break.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with our host today, Dr. Peter Glidden, filling in for Dr. Wallach. If you'd like to talk to Dr. Glidden today, we do have some open lines. Call us on the priority line at 831-685-1080. That's 831-685-1080. Lines open.
Hi, Judy DeVilbiss again. I almost forgot to talk to you about one of my very, very, very favorite products from Youngevity Company. It's called OsteoMag. OsteoMag is a wonderful magnesium supplement. And you know, magnesium is so very important for so darn many things in your body, especially your heart. But it's also good with your calcium drink. It's just a yummy thing. It's a good thing to take. I take mine every night before bed. And it also gets all of your insides starting to move around, and, you know, the next day you get to eliminate it all, if you get my drift. If you want to go into real personal behavior, give us a call, because we want to talk to you about those things, because those things that are moving in there are one of the most important things in your life. Let's get it moving. Let's get it. Let's just get OsteoMag.
For more information on this product, call your local Youngevity associate today. And we are back on Dead Doctors Don't Lie on the ZBS Radio Network. And filling in for Dr. Joel Wallach today, we do have Dr. Peter Glidden in with us today. Welcome back to the show, Dr. Glidden.
Hey, Doug, thanks so much. What did you pull off the wires today?
I've got a couple of news stories here regarding the use of supplements, dietary supplements, that is, and it's a report out from the CDC, Centers for Disease Prevention and Control, and they're saying that about half of all Americans use some sort of supplement, at least one, and I found that to be good news from the standpoint that possibly America is waking up and starting to move away from this drug industry and the
stranglehold that it has on medical health in this country. But the sad thing about it is it's still a lot of misnomers out there regarding supplementation. The good news is that they say the rise from about 42% of Americans taking supplements in 1988 to 53% by 2006 has driven a multi-billion-dollar industry. They say it's a behemoth of $27 billion, which I found kind of funny because the drug industry is that's maybe half a percentage of what they're doing, so it's not really that big of a deal in the large scheme of things. And they say that supplements are multivitamins used by about 39% of U.S. adults. And they say consumers, though, mistakenly view supplements to make up for a poor diet. And according to an expert with the CDC, a Dr. Orly Avilzur, they say that multivitamins can be an insurance policy if you don't get enough specific vitamins, but it can't replace a healthy diet. So once again, they're still going at this from the angle that all that you need is right there in the 4 basic food groups in your food pyramid, and if you just eat the proper diet, you're going to get everything you need, and you and I both know that's a bunch of hooey. And along with this, so they say about 61% of women over the age of 60 are taking a calcium supplement of some sort, and only 28% were doing so back between 88 and 94, and they say also 56% of the women in that age group take vitamin D supplements, which we know that's important in bone health, compared to only 30% back in 88 to 94. They say scientific evidence has shown that vitamin D and calcium can help treat bone loss. Of course, folic acid, we've known for a long time, can help women that are pregnant prevent major birth defects. And they even go so far as to say that zinc may help curb the cold symptoms. And they looked at a sample of about 40,000 people using data from the National Health and Nutrition Examination Survey to come up with all these numbers. But the sad thing is, as we know from talking with Dr. Wallach, there's 90 different essential nutrients that have been identified that are really necessary for good health, and just taking 1 or 2 really doesn't help you that much, because there's the whole issue of cofactors. As an example, calcium needs magnesium in a proper ratio in order to actually use it properly. So if you're not supplementing with magnesium, you can take all the calcium you want, and most likely, as the medical industry says, you're just going to have expensive urine.
Well, it's a perfect example of, allopathic medical arrogance. Medical doctors, asking a medical doctor for advice about nutrition, whether it's food or vitamins, is like asking a communist about voters' rights. It's just completely outside of their frame of reference, and the medical doctor has no business even opening his or her mouth regarding anything about clinical nutrition because they have no training in it and no clinical experience, and yet they give their opinions about it all of the time. This is a gigantic problem in the United States. And, the sad fact of the matter is that Dr. Wallach's research, $25 million of federally funded research, 26,000 autopsies, 10 million blood chemistries and histopathologies that took place over 12 years, conclusively showed that the majority of chronic disease is caused by nutrient deficiencies. There are 147 diseases caused by a calcium deficiency, and that's just calcium. That's one of the 91 essential nutrients. Medical doctors have completely missed the boat with this. They have completely missed the boat, and we suffer every day because we listen to these knuckleheads talk to us about stuff they have no experience with. I mean, there ought to be a law, quite frankly. We need our heads examined collectively. Now, the other side of this coin is we spent over $70 billion a year last year on nutritional supplements, and everybody is still sick. Why is that? Because when it comes to nutritional supplements, the recipe, the dosage, and the absorbability are everything. And if you want to know good nutrition, talk to a longevity representative because we have it dialed in. Dr. Glidden, taking your calls on the other side of the break.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with our host today, Dr. Peter Glidden, filling in for Dr. Wallach. If you'd like to talk to Dr. Glidden today, call us on the priority line at 831-685-1080 or toll free at 888-379-2552.